So we also have Dr. Stephen Chan, a dentist, that will be coming up here to talk about what he's going to do.
This is the...
That's forward, yep, and you can even do that. Yeah.
Okay, thank you. Good morning. Well, in 5 minutes, I'd like to make that mouth and body connection with you. Many people tend to think that the mouth is not that connected to the body, but actually, 80% of what happens wrong in your body originates in your mouth. In fact, if you have chronic illness, things like autoimmune diseases or cancer, the first thing you need to do is actually clean out your mouth of inflammation, infection, even toxic materials that are placed in your mouth. This should be cleaned out first before you even clean your internal organs. So in this next slide, I'd like to show that the tooth is actually not just a solid material, but there are fluids that run through it. As hard and durable we think of enamel is, it runs through it some really microscopic tubules that connects with millions of other tubules that permeates the dentin. In fact, there is a connection between the enamel to the dentin and to the nerve endings and the blood vessels that's at the center of the tooth. There's constant nutrient exchanges through the fluids from your body that flows through your blood vessels into the tooth, out to your dentin, and into the enamel. This is what determines the susceptibility of your tooth, whether it's going to decay or not, because the nutrients is brought through the surface to constantly repair the surface of the tooth as it gets damaged by the acids in your mouth. That saying about what happens in Vegas stays in Vegas? Not so true in your mouth, right? Because it's ludicrous to think that the mouth is not connected to your mouth, to your body. It's whatever happens there, it could easily go anywhere in your body through your blood vessels and through your lymphatic system. For example, in our practice, I have a case here where there's on that first slide up there, there's a failed implant that on one of my patients, and we had to remove that implant and replace it with another implant and then fix that bone. But as you can see on that bottom picture, on the far left of that picture is the new implant with nice bone around it. All this happened under 4 months with the help of the Beamer. And I have another patient who has, oops, going back. Uh-oh. Sorry about that. All right. This patient, as you can see, the one with the root canal there's an infection in the root canal, and it's a failed root canal, as we can see. But the patient does not want to have it removed because it's part of a bridge. So all we did with her was to do Beamer once a day, because it's all she can do, to come to the office 3 times a week. And in 7 months, you can see that the bone actually healed up around that apex there. And she is no longer feeling any discomfort. And I'm proud to report to you 2 years later today, that is still the case. She has not had any recurrence. So people ask me all the time, what do I do with Beamer in my dental practice? Well, I can show you that these are the different types of things that we use it for in the office. Take note of that so you don't keep asking me. So it really helps, and we put the mat or the pad over the B-body on the patient in our dental chair. But many times, because I'm a whole body dentist, I also have a wellness center next door My wife, my lovely wife, who's a nurse of over 40 years, is in charge of that place. But I oversee all these patients, and we put them in that center for a better environment, away from the dental drills and sounds, so they can relax. And we use them to lower their blood pressure, so I can do surgery on them. And then we send them back over there so that they start healing. And that's it for my presentation. Thank you.
Dr. Chan, thank you. Here, get some water too. We'll be talking. Perfect. Thank you so much. Let's jump over to Dr. Chan. Is your mic hot there, Dr. Chan? Operational? Yep, good. Why do you believe Beamer is so important after dental work, and how does it benefit your patients?
Well, in my case, I do a lot of surgeries and even some deep gum work. It's so important because when we normally, like what they said about anesthetics that really stops the vasomotion, and we do a lot of local anesthetics that will truly stop the vasomotion around the teeth. And so we put them back on the Beamers to restore that, to help the healing process a lot quicker. And after surgery especially, the fibrin gets to the area a lot quicker and the clotting happens a lot faster.
In addition to that, what applications and settings are you generally using around the mouth? That's an interest of mine, I'm curious.
Application I usually just use from around intensity 1 to 3 without the plus, using the B spot.
Excellent, thank you. Dr. Chan, how does Beamer work in the mouth? I mean, and is there any differences in the mouth region versus any other parts of the body from your perspective? Yeah.
Well, as I've said, there's a mouth and body connection. There really isn't a whole lot of difference. Whatever happens in the mouth happens to the body. I would recommend, if this is all new to you, because a lot of my colleagues have created an island to themselves that, they keep everything in the mouth. They have nothing to do with the rest of the body, which is not true. There's a good book out there that I would recommend, Mouth and Body Connection by Dr. Gerald Kuratola. You will really understand just basics, how our body is connected to our mouth. And the vasomotion is so important in the mouth because we're looking at bone in the jaw, which is not as vascular as anywhere else. And this is where we truly need as much as the blood flow as possible in order to help with bone loss and even all the way to the gum tissues.
In addition to that, do you generally, when you're doing procedures, are you generally seeing more bleeding, less bleeding? And in addition, does Beamer sometimes trigger pain in individuals as they're recovering or using it? What's your experience with that clinically?
What was that?
Meaning, when they're utilizing the Beamer post-surgery or in your practice, do you see less blood or less bleeding? And more importantly, do those individuals feel pain while they're doing the Beamer?
Oh, yes. Like I said, after surgery, I send them, to the Beamer room so that we get that clotting effect really fast, unless they're on blood thinners. I would always take them to the Beamer. I couple that with ozone therapy and sometimes with homeopathics.
Wonderful, wonderful.
And also with in terms of pain, yes, it definitely reduces it and it makes it more manageable for them, and they don't have to be on heavy narcotics.
And finally, before we go away from the mouth, I want to just go a little further than the mouth and go into regions which you deal with all the time: temporomandibular joint dysfunction, headaches. Are you utilizing Beamer not just on the jaw itself, but also in the neck, head, things of that nature?
Oh, yes. My experience with headaches, I have my front desk personnel always has migraine headaches. Every time she has this migraine headache, she gets to go home. Well,
that's not good for business.
But The very first day I received my Beamer, when she said, I have migraine headaches, the UPS man just walked right in with my Beamer. I put it right on it, 8 minutes later, get back to work, you know. So, yeah, it really helps. And of course, the TMJ, we treat ozone along with Beamer. Works like a charm. And we're talking about airway issues as well. So the Beamer really is a wonderful adjunct therapy in our practice.
Beautiful, thank you.
I want to thank you for watching this video. If you did like it, go ahead, hit the like button and subscribe to this channel. Once again, thank you for watching the video.